Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today I have with me Dr. Binod Dhakal from the Medical College of Wisconsin. He's an associate professor there, has really built a fantastic name for himself over the years now, chiefly in the area of multiple myeloma, stem cell transplant, cellular therapy, novel therapies, bispecifics. We're really glad to have him here today. Welcome, Binod.
Thank you, Dr. Vij.
So, Vinod, we're going to just talk today about, CAR T and bispecifics. And we'll talk a little bit about, the immediate aftermath of the infusion, but more focus on the long term. How do you follow these patients? Both patients and doctors in the community want to know what to do because this is a new modality of therapy. Like, what do you do with these patients? So, just to start off with, obviously, we have for multiple myeloma now got two CAR T cells. We've got Abecma and Carvykti, and we've got three monoclonal bispecific antibodies, teclistamab, telcatamab, and erlantamab. Obviously, they have their differences, and we're not going to get into what differences are there, but generally there are some common themes in their management as well. Certainly, CAR Ts and bispecifics have a little bit of difference, but we'll get into the nuances there. But first of all, one of the things before we get into the long-term management, everybody wants to know is everybody's heard of this word, cytokine release syndrome now. So, and it is because of the immune cells and the cytokines they secrete. So, how do you manage a patient with cytokine release syndrome? What are you seeing, and how do you go about tackling the issue? And would love to see. And also, I think you do some of this outpatient as well. So,
Correct.
what is your strategy?
So, yeah, that's a very important question. As you know, two main side effects of this T-cell engagement therapies, I would call it, whether it's a CAR T or bispecific, are cytokine release syndrome and the neurotoxicities. So if you just focus on cytokine release syndrome, I mean, to be honest, we have been much better now on how to manage than what we used to when it was 5 years ago. When things first started, I can tell you, like, when the cytokine release syndrome happened, then, you used to be very nervous and try to do, like, don't know what to do,